Have you ever wondered what the difference is between a psychiatrist and a psychologist? You're not alone. Even today, many people confuse the two, sometimes thinking they're interchangeable or that one is just a talk doctor and the other gives out pills. But the truth is, while psychiatry and psychology often work together, they are distinct fields with different training, tools, and approaches. So in this video, we're going to break it down. We'll cover the education and training paths for both, what each professional actually does, where they overlap, and where they don't, who you might want to see for specific problems, and how these fields are evolving in today's mental health landscape. Let's clear up the confusion, once and for all. First, let's define the term psychiatry. Psychiatry is a branch of medicine focused on the diagnosis, treatment, and prevention of mental, emotional, and behavioral disorders. Psychiatrists are medical doctors with an MD or DO after their name. They can prescribe medications, they can order blood tests, brain scans, or hospitalize someone if needed. They often work with complex, severe mental illnesses. Psychology is the scientific study of the mind and behavior. Psychologists are usually PhD or PsyD holders. Doctors of psychology, not medicine. They provide therapy, do psychological testing, and focus on how people think, feel, and behave in different contexts. They do not prescribe medications in most states, though there are exceptions. We'll get to that. Education and training, different journeys. Let's take a look at the academic and professional paths for each. To become a psychiatrist, undergraduate degree, 4 years, medical school, 4 years, MD or DO, psychiatry residency, 4 years, optional fellowships, 1-2 years in areas like child psychiatry, forensics, addiction, board certification, and licensure as a physician. Psychiatrists study biology, pharmacology, neurology, pathology, along with mental health. They are trained to understand how the body affects the mind, and vice versa. To become a psychologist, undergraduate degree, 4 years, usually in psychology or a related field. Graduate school, PhD or PsyD, 5 to 7 years, includes research, coursework, and clinical training internship, and supervised postdoctoral hours, 1 to 2 years, state licensure exams. Psychologists are trained in research, therapy, behavior, and testing. They learn how people think and feel, how to measure personality and intelligence, and how to change behavior over time. What they actually do, practice, and scope. Let's now talk about what psychiatrists and psychologists actually do in practice. Psychiatrists diagnose mental health disorders, prescribe medications, e.g., antidepressants, antipsychotics, mood stabilizers, monitor physical health alongside mental symptoms, provide some psychotherapy, though less commonly now, order lab tests or neuroimaging, treat severe illnesses like schizophrenia, bipolar disorder, suicidal depression, may work in hospitals, emergency rooms, forensic settings, addiction clinics. Their main tools are diagnosis, plus medications, plus medical evaluation. Psychologists provide psychotherapy, CBT, DBT, EMDR, psychodynamic, etc., conduct psychological assessments, IQ, personality, memory, learning disabilities, diagnose mental health conditions, design behavioral interventions, research mental processes, work in schools, clinics, private practices, academia, or corporate settings. Their main tools are talk therapy, plus testing, plus behavioral science. Do they ever work together? Absolutely. And in many cases, they should. This is called collaborative care. For example, a patient with depression and insomnia might see a psychiatrist for medication management and a psychologist for CBTI, cognitive behavioral therapy for insomnia. Another example, a child with ADHD might see a psychiatrist for a stimulant prescription and a psychologist for behavior modification and parent training. This team-based approach provides comprehensive care, treating the whole person, not just symptoms. Key differences at a glance feature psychiatrist, psychologist degree MD or DU PhD or PsyD prescribes medication? Yes. Usually no, except in 5 states. Medical training? Yes. Full medical school? No, provides therapy. Sometimes yes, extensively conducts testing. Rarely yes, IQ, personality, etc. Typical setting: hospitals, clinics, private clinics, schools, private best for complex cases, meds, diagnosis therapy, testing, behavior change. Wait, can psychologists prescribe in some places? Yes. In a few U.S. states and territories, specially trained psychologists can prescribe medications. New Mexico, Louisiana, Illinois, Iowa, Idaho, the U.S. military and Indian Health Service. These psychologists complete additional medical training and must be licensed for prescriptive authority. However, this is still not the norm in most of the world. Common misconceptions. Let's clear up a few popular myths. Myth number 1. Psychiatrists just give pills. They don't care about people. Truth. While psychiatrists often focus on meds, many still offer therapy, listen deeply, and treat the whole person. Time constraints and insurance models often dictate shorter visits, but that doesn't mean they don't care. Myth number 2. Psychologists can't diagnose anything. Truth. Psychologists are licensed to diagnose mental disorders. They often perform more in-depth assessments than psychiatrists using structured tools and interviews. Myth number 3. You only need a psychiatrist if you're crazy. Truth. Psychiatry helps with everything from anxiety and sleep issues to postpartum depression and trauma. Needing medication or a psychiatrist doesn't mean you're broken. It means you're getting help. Who should you see? Here's a general guide. See a psychiatrist if you're dealing with severe symptoms, psychosis, mania, suicidal thoughts. You need or are considering psychiatric medication. You've tried therapy, but symptoms persist or worsen. You have complex medical and psychiatric interactions. See a psychologist if you want talk therapy for depression, anxiety, trauma, or relationships. You need psychological testing, ADHD, learning issues, neurocognitive decline. You're interested in non-medication strategies to manage stress or mood. You want to change behavioral patterns, OCD, phobias, addictions. Best case, see both. Many people benefit from combined treatment, meds from a psychiatrist plus therapy from a psychologist or counselor. Mental health isn't one size fits all, and more support is better than less. What about other mental health professionals? Quick shout out to other amazing professionals in the field. Licensed clinical social workers, LCSWs, provide therapy and case management. Licensed professional counselors, LPCs, offer therapy for a range of issues. Marriage and family therapists, MFTs, focus on relationship and family dynamics. Psychiatric nurse practitioners, PMHNPs, can prescribe meds and do therapy. Behavior analysts, BCBAs, work on behavioral plans. Often with autism spectrum, mental health care is a team effort, and there are many paths to healing. Final thoughts. So, what's the real difference between psychiatry and psychology? Here it is. Psychiatry comes from medicine with a focus on biology, medication, and crisis care. Psychology comes from science and behavior with a focus on therapy, testing, and personal growth. Both are essential, both are powerful. And when they work together, patients get the best of both worlds. So don't worry about which title is on the door. Worry about whether that professional understands you, listens to you, and wants to help you heal. That's what truly matters. If this video helped clear up the differences, give it a like, share it with a friend, and hit subscribe. Drop a comment. Have you worked with a psychiatrist, psychologist, or both? What was your experience like? Until next time, take care of your mind, and remember, there's no shame in seeking help, only strength.